Assalamu alaikum. Very loud. Hi everybody, welcome. So we are going to get started. Apologies for making you all wait. We are going to get you all ready, and I'm going to introduce our wonderful panelists for today. Before we get started, my name is Aya Sadir. I'm the founder of Bolt Consultancy, who's actually organized this event for you today. So we hope you will enjoy it. I would love to introduce at the last seat of the panel, Dr. Yasir Khan. Dr. Yasir Khan is somebody who believes in being a forever student within his field. He is a certified physician with passion and expertise in health informatics. His diverse background of clinical training, software engineering, along with a master's in health policy and economics, enabled him to develop various award-winning programs for better patient outcomes through information system transformations. Apologies, I think we're, yeah, okay. So Dr. Yasir, with your international experience over the past 2 decades within the healthcare industry, I'm confident that we're going to have a very fruitful discussion on very exciting topics we've prepared for today. Let's have a big round of applause for Dr. Yasir. Thank you all for joining us today. Second, we have Mr. Ghalib Hafiz, who is an MBA holder from Stanford University. He is currently the associate partner for McKinsey and Company, based in the Middle East office. Welcome, Mr. Ghalib. He is specializing in healthcare systems and services and in private equity and principal investments. Some would say that Mr. Hafiz is known as a market launcher with extensive experience supporting the healthcare ecosystem with a specialty in new healthcare builds. With Mr. Ghalib's background in private equity and his extensive experience in healthcare, we should say it is a true honor to have you join us with us on the panel today. Thank you so much, Mr. Ghalib. And finally, we have Mr. Faisal Younes Ali, who has more than 2 decades of working with the government on leading change. It is an honor to have you represent Emirates Health Services on our panel for today as the Revenues Manager. I'm sure we will be discussing how the other panelists and yourself will contribute to discussing the future of healthcare, and especially with you, Mr. Younes, in discussing how infrastructure will play a very important role physically and even more so digitally in the coming future. So let's get started. Let's have a big round of applause. Thank you so much. So just high level so that we can clear the agenda for today so you know what we will be discussing. A few of the topics will include data monetization in healthcare. We will then talk about how AI technology is utilized in diagnostics and treatments. We will then move to insights on investments in health innovation, which is very exciting, I'm sure, for most of you to learn about. And then finally, how do medical entities use technology to generate different revenue streams today? So without further ado, I'll start with the first question, which I'll offer to Dr. Yasir. What are the recent patterns of impact related to technology in healthcare that you have been observing at Cerner?
Thank you, Aya. I think before I answer directly this question, I will just start to form it out by looking at technology and just how it can connect different layers. Every time we look at any intervention in a healthcare domain, look at that golden triangle of accessibility, affordability, and clinical column. I have observed or I have developed in that there is a third big element which is around end user acceptance, which kind of explains that there are some of the technologies which have been around for almost decades, but they have never been able to caught on, they have never been able to make their mark just because it has been either culturally not acceptable or humanly they were not there yet or not ready yet. But especially in the last 2 years, there has been some big shift changes in terms of end user, which is frankly physicians, us, and end user in terms of patients and end user in terms of healthcare management, to look at alternative way of providing healthcare and making sure we hit accessibility, affordability, and clinical quality. And because there was no other way of doing it, so now I look back at least now 2.5 years, the top of the agenda in terms of patterns of technology is definitely around telehealth. And the telehealth again has been an area for ages, but now we are literally looking at the patterns of how people are accessing healthcare on their mobiles. There was a study done which mentioned that 84% of your visits did not actually require a physician to actually touch a patient physically, and mostly those consultations can be resolved in terms of telehealth. So that was very powerful, that at least more than 80% time, you don't really have to be physically in terms of in front of a physician. Telehealth, of course, also involves your wearables. Now, most of our wearing Apple Watches with now coming up with ECG interpretation in them. Similarly, we have variables which are connected to 4G and 5G, which are your weight machines, your other glucose meters, and so on and so forth. So you really don't have to be physically in front of everyone or your physician to actually be treated. So telehealth definitely has been making a lot of headroads and providing service for all those communities who are very difficult to serve before. Other, I think the patterns that I'm also observing is around genetic sequencing. How genetic sequencing is becoming more and more mainstream. It not only in terms of getting you your personal genetic sequence and giving you insights into what kind of condition you probably have disposition for, but I think mostly we have heard one of the high-profile cases back in US where they were able to use these techniques to make sure that they can actually implant animal kidney and animal heart into a human being, and that was done because of advances in that techniques. And I think no conversation would be complete without using or mention of AI learning. Definitely from past 20 years has given us EHR, past 20 years has given us big data, past 20 years has given us adoption of those technologies. What AI has done for us is recognize those hidden factors in that data and allowed us to come up with those interventions in those understanding of the disease processes. So I'm seeing all those elements working together to really revisualize how we will be entering into a post-COVID era.
Perfect, and that's such a great point, and it even brings me to my next question for Mr. Ghalib. I know we had discussed how healthcare has changed over the past 100 years, and how it's planning to change over the next 10 to 20. So just going off of the discussion about now, we are talking about AI and how it's affecting the healthcare industry at large. How do you see the changes in the next 10 to 20 years in the healthcare industry?
So if you talk about the past 100 years, right? So as a human race, we've added something like 40 years to life expectancy. So in the 1900s, in the early 1900s, the average person living anywhere in the world was expected to live up to around 30, 35. Today, that's 70, 75, and still extending, right? So the advances in healthcare that have taken place basically in the last roughly 100 years, when today's hospitals and today's healthcare system was actually innovated, were basically overcame a significant inflection point in treating what we call in healthcare communicable diseases or infectious diseases, right? So, but what's happening today in the healthcare system, obviously the healthcare system still has to treat those and address those, but what we're seeing is this explosion of non-communicable diseases or lifestyle diseases. And the healthcare system as it's set up today is not designed very well to handle that. So in a sense, before, when you had an acute sort of infectious event, you would go into the hospital or into the clinic, you would get taken care of by a healthcare provider, and then you would go home. What's happening with chronic conditions is you've got this slow onset and continuous buildup over many, many months and many, many years that requires not just visiting a doctor or seeing the doctor over a teleconsult, but more fundamental and holistic health and well-being interventions, to which today's healthcare system is not as well attuned to address that or to serve that. And that's why all of these different innovations that are taking place are so fundamental and so crucial, because again, to extend the next 10, 20 years of life, it's not going to happen just in the hospital or in the clinic. It's going to happen at home, it's going to happen in your daily life. And there are fundamentally a whole range of technologies that will support this. Yasir touched upon many of them, right? So fundamentally there are 4. But I mean, basically we've just started scratching the surface in terms of the data that we'll collect. I mean, so everything from wearables to not only your genomic sequencing, but all of there's a number of additional fields in omics that give you a very, very high resolution picture of what's happening in the medical composition of a human being. It's also the environment, it's what you're doing on a day-to-day life. And when all of this multi-dimensional data is brought together, facilitated by connectivity, powered by AI and by automation, the types of interventions and innovations that you'll have in the outcome of human life expectancy and well-being are just going to be fundamentally different to sort of the traditional healthcare system in the past that did what it did, but it's going to change and evolve very, very fundamentally in the next 10 to 20 years.
Incredible. And now we're sitting on the panel with Emirates Health Services, and I'm sure a lot of you are wondering this question, right? So when it comes to Emirates Health Services, what do you think, or how do you think telehealth is affecting the future of healthcare? How do you think this will support physicians specifically and the usage of facilities, right? So physical facilities where we're going to visit hospitals, where we're going to meet a physician, and what could be the potential risks in this? So, for example, in diagnosis of patients. So that's how specific I think this question will go. But going back to thinking about how telehealth will be affected, I would love to know, Mr. Faisal, what do you think?
السلام عليكم ورحمة الله. طبيبي اللي تفضل فيه الدكتور غالب بخصوص موضوع إعادة تصميم الخدمات وكيفية تأثير خلينا نقول الذكاء الاصطناعي. طبيعي وزارة الصحة رغم حداثة النشأة في 2 سنين لأن تتماشى مع استراتيجية دولة الإمارات بالذكاء الاصطناعي، والكل عارفين أن القطاع الصحي نسبة بباقي القطاعات الموجودة في الدولة يتماشى مع هذه الاستراتيجية، وبالتالي سقطت هذه الاستراتيجيات على الإدارات اللي موجودة في مؤسسة الإمارات للخدمات الصحية. تم تصميم الخدمات الموجودة عندنا بما تتوافق مع الذكاء الاصطناعي في مبادرات كثيرة موجودة تفضل فيها دكتور غالب، التطبيق عن بعد إحدى خلينا نقول المبادرات اللي عملتها مؤسسة الإمارات. في مبادرات أخرى حاليا في خطة المؤسسة للانتقال من اللي هو الخدمات التقليدية إلى خدمات تتواكب مع الذكاء الاصطناعي. طبعا في هذا التصميم أو خلينا نقول التنقل من خلينا نقول التقليدي أو الخدمات التقليدية للذكاء الاصطناعي، في هناك أكيد شركاء راح يكونون معنا خلال الفترة الماضية سواء كان القطاع الخاص أو أيضا اللي هي الجهات الحكومية الأخرى اللي تشارك معنا في اللي هو التحول اللي راح يصير إن شاء الله خلال الفترة. كثير من تعمق كثير في الاستراتيجية اللي موجودة للمؤسسة راح تلاقين هي تتوجه إلى موضوع الذكاء الاصطناعي، وهذا أيضا خطوة من المؤسسة تدعم الذكاء الاصطناعي. أكيد طبيعي في أي مبادرة راح يكون هناك في خطورة، ولكن المخاطر هذه تم دراستها من الفرق الفرعية واللجان الفرعية والرئيسية الموجودة في المؤسسة بحيث أن تقلل من المخاطر اللي ممكن تسبب فيها التكنولوجيا سواء كان الذكاء الاصطناعي او حتى خلينا نتكلم عن يعني التقنيات الحديثه اللي جايه بشكل سريع جدا. والحمد لله المؤسسه تتواكب مع هذا التطور بالتنسيق مع جميع الجهات الحكوميه او حتى مع القطاع الخاص.
شكرا Mr. Faisal. So I will translate as much as I can. If I make any mistakes, there are a few people in the room who will shout at me. So just to maybe recap what Mr. Faisal was saying is, as a government, we are moving towards AI, right? So everything that will be serving the healthcare industry in the coming future is around the strategy of incorporating AI. We of course have to assess any of the risks in advancing towards any technology, and that's why from every angle of the government, from within the companies and also with the help of their partners, they're assessing how to integrate this in and at what speed. And having worked with Emirates Airline for many years, when we talked about technology, take for example, if any of you have gone through the tunnel, anybody who's been through the tunnel that detects you? So that's been a project that's been developed years ago. The technology had existed, but when we spoke to leadership about adoption, the biggest question they had was not about a perfect adoption, about a perfect solution. It's about assessing how much adoption you can create when it comes to integration of technology. So even though we might have incredible solutions offered by some of the most amazing partners for Emirates Health Services, we have to always account for the fact that not everybody will accept the technology. There will always be pushback. There will always be restrictions on how much we can actually incorporate in technology. So definitely, Mr. Faisal, I think we're all with you on this wonderful point. Speaking of adoption, actually, I have a second question for you, Dr. Yasir. Why do you think the healthcare industry in specific has been lagging in the adoption of health information technology compared to perhaps any other industries? And feel free to also discuss any of the other industries, Mr. Ghalib.
Thank you. So that has been, I think, my personal struggle since coming out of the medical college, because when I see information technology, medicine itself such an information-heavy modality that we depend on your past medical history, you depend on what has been done before to create a profile of a patient to make a right decision for a patient. So it just felt like a very natural fit that it will benefit from information technology. But on the other hand, when I look back at in comparison to the other industries, it's always lagging behind at least 10 to 15 years. And people do start to wonder what is the reason behind it. And one of the reasons put behind against different think tanks have put together, there is a regulatory requirement, and hence there are barriers to entry for companies. There are penalties involved if you get something wrong, for example. Others have pointed out, as physicians, we are big responsible because we are resistant to change and we want certain things to be a certain way, and we see that technologies coming up is taking away my autonomy to do medicine, practice medicine the way I want to practice medicine. So there are different thought processes. My personal one is slightly different. I feel that medicine being a different science than the computer science, it has always been very difficult to marry them together. What I mean by that is medicine is not an exact science. Between the four of us, if we are four of us running fever, I'm going to give paracetamol to all four of us, there will be a very different reaction to the medication being given. That's just a very simple example. When robots are being used to assemble cars completely autonomously in factories, even in 2021, you don't have a robot that you can train and you can do a complete autonomy appendectomy on a conveyor belt. Because of the individual variation, because of everyone is different. And medicine works on that inferential decision making by a physician, which takes away all that information around you and your family history and what happened before and so on and so forth. So to marry it with a very concrete dimension like a computer science, which work on only zeros and ones, it's always been very challenging. You hear about evidence-based medicine a lot, but you never heard about evidence-based construction or evidence-based financial. In financial industry, construction industry, it is what it is. When the rules are laid out, they are rolled out, and they are the rules of the road that you follow. However, in medicine, we keep doing, and especially now COVID, everyone is aware of clinical trials. A vaccine that is 91% effective is great. You're all going and putting in line to get the vaccine. You will not go and sit in a building which is 91% supposed to survive at the end of the year. You won't do that. So these are fundamental differences in the way medicine is and the opportunities for it to be served by technology. And I wonder, this is one of the reasons that healthcare is lagging behind. And now our technologies are thinking and addressing these, especially with the big data, because now they are able to observe those hidden patterns that command that 91% fair enough, but the other 9%, what does it tell us? How can we make sure that we are also safe from that angle as well? If we are not going to consider these aspects, even in future direction, then we will still see the lag continues.
Just to add to that, right? So, when you look at startup sort of quotients for healthcare compared to other industries, you find healthcare is always second last. So all of the innovations that you've seen in startups, so Airbnb is in the hospitality sector. There's a number of innovations in travel, tourism, transportation, and so on. And one of the salient drivers, in addition to the ones that Dr. Yasir mentioned, is healthcare is not a direct-to-consumer business, right? So the one salient thing that you find, so you always have this provider in the middle. And to Dr. Yasir's point, the providers are in this slightly murky world of evidence and science and things being probabilistic, are less amenable to that change. Whereas Airbnb was created, the proof of the test was in the consumers who just love that product and its proposition. So I think that is one of the most salient differences. But having said that, I think there's an entire host of startups that is betting on the thesis that a lot of healthcare can actually be protocolized and turned into algorithms. And we have the technology now in natural language processing and so on to fundamentally almost disrupt the physician in a way, right? So even your primary care physician, in the future, this is going to be dealt with by the chatbot. You enter your symptoms, and there's some people who theorize or hypothesize that this is actually going to be more accurate and faster and better, and to Dr. Yasir's point, more accessible, higher quality, lower cost than this vast infrastructure and health system that we've built.
I would love to touch on this point actually, because the Emirates Health Services team have been dealing with immersive technology and have been discussing ways to exhibit things even futuristically in the metaverse, right? So I know it's the new hot topic, the metaverse, which I'm sure you're all listening to and hearing now. If I would love any of you to answer this question on the metaverse, what are you, imagining the healthcare industry will look like within that technology?
I think we had a session because we try to look forward to what will be in next 5 years, and then especially working with Emirates Health Services, what that landscape would look like. And in those blue sky thinking ideas, metaverse was one of the favorite topics, as you mentioned. And the way, like I was saying earlier, telehealth is definitely blossoming into multiple subspecialties. Remote patient monitoring is one, mental health being is another, virtual reality and augmented reality for neuropsychological disorders, another, phobias. Particular assessment is around assessments of it, so immersing yourself into that kind of 3D environment where you do interact with either avatars of real people or machine language driven avatars. Your interaction with them, a conversation with them comes back and has some pointers that provides that feedback to say, from a mental health perspective, which stratification you belong into and where you're heading, and depression screening. So very innovative way. Now that we have access to a large number of data, we can have our own risk stratifications built in, especially for client perspective. When I'm talking about Emirates Health Services, we can work on risk stratification for the population we serve, rather than risk stratification which was done on a different population altogether. And those algorithms can be brought very quickly into Metaverse. And if we have large number of users in Metaverse, that's a very, very promising. So it allows us to be very agile. It allows us to deploy solutions very quickly and assess their efficacy without having to go out in a big clinical trial format.
Other buyers on the question?
Look, I mean, I think it opens up, it opens up an entire area around kind of the psychological experience in mental health, right? As Dr. Yasir mentioned, in the news, there have been a number of incidences of interactions that different users have had in the metaverse that ended up, either with a physician, with mental health issues, or even with the authorities, with the police and so on. And I don't know if there's any good answers there, but it raises a whole set of questions around, what is the human experience, and then how do you marry that into, holistic sort of human experience, both in the physical and in the meta world.
So how can we combine, let's say, research to be able to effectively support patients in the future? And that could be a good hybrid solution. And again, believing that technology is never perfect and is never 100%, it has to be a combination.
اسمحي لي استاذ آية هنا اضيف تفضلوا في اخوان. اكيد تفضل فيه دكتور ياسر، تطوير التكنولوجيا على مستوى العالم خلال الفترات الماضيه، السنوات العشر الماضيه كانت بشكل كثير من الجهات، سواء كانت الجهات الحكوميه وحتى المنشآت، كانوا يتبنون هذه خلينا نقول الذكاء الاصطناعي. ويمكن نحن عندنا حاليا على مستوى العالم يتكلمون عن موضوع الميتافيرس وكيف استخدام الميتافيرس في القطاع الصحي او حتى في القطاعات الاخرى. يمكن ناس ما تفضلوا الاخوان، يعني خلينا نقول التقنيه هذه حديثه، ويمكن في بعض نقاط الضعف اللي فيها ممكن تكون محتاجه دراسات اكثر، سواء كان في القطاع الصحي او حتى في القطاعات الاخرى. ايضا موضوع الاخلاقيات العمل، ممكن هذا الجانب ممكن يكون سبب ومؤثر في مدى امكانيه تطبيق الميتافيرس او الامور هذه. هل العميل او خلينا نقول بيشنت يتقبل الموضوع؟ آلية استخدام الميتافيرس كيف راح يكون؟ اتوقع ان الحديث يمكن سابق لاوانه، لكن الحمد لله المؤسسه دائما يتبنى جميع التقنيات الحديثه، التكنولوجيا الجديده، وفي امانه ممارسات اللي تفضل فيها الدكتور ياسر اللي هو التطبيب عن البعد. في اثناء الجائحه المؤسسه الحمد لله لم توقف امام الجائحه، الحمد لله طوعوا التكنولوجيا اللي كانت موجوده، وكان طبعا الانتراكتيف اللي كان مع البيشنز الموجود عندنا من خلال التطبيب عن بعد، وكان هذا الشيء شكل ايجابي في الوصول والتواصل مع المرضى الموجودين عندنا في DHS.
Dr. Faisal Younes. So basically, to summarize as effectively as I can, I was talking about how the next few years we're anyways accepting new technologies such as AI. Metaverse is of course a very important discussion. Like any technology, we have to observe it with caution. At the end of the day, we cannot jump at every technology that comes at us, right? But we have to accept, learn, study it, and if we have enough patient acceptance, which is most critical in this, outlining all the different consequences of choosing such a technology, then we're willing to take this on as Emirates Health Services. We took on Jaiha, which means COVID-19, which I of course learned. I think most people in the room learned Jaiha at this unfortunate time. Emirates Health Services has gone head on with this pandemic, and we will go head on through any opportunity that can support patients across the United Arab Emirates. So that's thank you so much, Mr. Faisal. So based on of course We've discussed some of the disruptive technologies. I'd love to move into new trends in healthcare. So we've mentioned AI, we've mentioned, of course, facial recognition, metaverse. What could be other assisting technologies that we should be thinking about, perhaps as Emirates Health Services? What should we think about what's coming next? Oh, sorry. So, yeah, we'd love to bring the Director General to come up. Have a big round of applause, maybe. And we'll just interrupt the panel.
السلام عليكم ورحمة الله وبركاته. وأنا اليوم معاكم في هاي discussion. يعني a lot of really interesting stuff and a lot of things that we will see. The مشكلة الصوت يقطع؟ okay. So a lot of things that we will see at the metaverse and the virtual reality will really have an impact in the life of our customers and patients. So just wish you really a fruitful day. Thank you.
Okay. Thank you so much. It's an honor to have you stop by to see us. We'll proceed with the panel. Yeah, Mr. Hafiz.
So on your question of emerging technologies, right? So they roughly fall into 4 buckets. The first one is obviously new therapies, new ways of treating people. Second one, and the 3 sort of they talk together. So there's connectivity, AI, and automation. And I mean, we could talk about this for days, right? But I'll just give a few examples. On new therapies, so healthcare is moving from what it was in the past, very, very broad biomarkers of what happened, you have a fever, et cetera, into highly personalized medicine, right? That means you have multiple layers of data from your behavior, your environment, to your genomic makeup, all of the other omics, et cetera. All of that will combine into offering sort of what's called precision medicine, and then also very, very clear preventative and early diagnostic markers, right? So that's the whole area of new therapies or early diagnoses. You also have within that digital therapeutics and so on. And you're seeing that today. So for example, precision medicine, you're seeing it today in cancer treatment. There are 70 or 74 also gene markers, genetic markers that can predict with very, very good accuracy things like breast cancer, cardiovascular risk, and so on. Then you've got this interplay of all the other technologies, right? So you've got connectivity, the fact that we have these wearables and we can do remote monitoring, and the provider, the workforce no longer has to sit and physically observe the patient anymore. And you could think of this in an ICU setting in a hospital where historically you needed an ICU trained nurse, a very, very highly capable nurse, sitting there one-to-one, offering coverage to a patient. Now you have a number of different remote monitoring solutions, right, that actually drive that equity and that accessibility. So if you live in a remote region where attracting workforce is actually a big challenge, you don't have to suffer from suboptimal healthcare outcomes anymore, because you can set up a remote monitoring station, and the workforce in that remote area can have a second level of support facilitated by connectivity, right? These are just some of the examples. On AI and automation. You're already seeing sort of AI being used in radiology, for example. So AI today, these repetitive tasks that are very, very specific in nature, AI can actually do it faster, better, and so on, than human beings, which will make perceptual and behavioral errors. In automation, you'll see a lot of tasks. And again, this is where healthcare still is fundamentally a very, very human industry. So the healthcare workforce will still have to interact with the patient. But some of our research posits that up to 35–40% of tasks within healthcare could be completely automated by 2030. And that means some of those cut across physicians, some of those across nursing, but a lot of tasks in administration and so on. That's where the bulk of the work actually happens in any hospital or any clinic can be automated.
And how does that help the healthcare industry? Is it something that we are, is this going to support patients, or is it going to support physicians? Is it going to support healthcare institutions? This is my, who's going to really help in that?
So I think if we look at the end goal, right, which is this trifecta of cost, quality, and access, it will drive fundamental improvements across all of those, right? Cost we talked about, both for the patient and for the system in general. You don't have to put expensive workforce in remote areas any longer. Patient doesn't have to go. 5 or 10 years ago, if you had something even as simple as a upper respiratory tract infection, you had to go to the clinic. So I think on cost, on accessibility then as well, and then also quality. So in radiology and even in, let's say, primary care diagnostics, protocolized automated care, it can prevent the vast majority of errors that happen in the healthcare system, because human beings ultimately are either biased or driven by the limitations of their perceptual experience.
If I may add, so one of the exciting developments is around, definitely for me, is computer vision. So consider the element that in sub-Saharan Africa right now there are at least 100 million females which should, for any standardized practice definition, should be receiving every 2 to 5 years mammograms. However, more frequent the better. But however, we know that it takes 20 years to train a radiologist. And then you need infrastructure, you need people to run the clinics and so on and so forth. If now with the current technology, the machines which have built-in the algorithms to highlight the most higher risk mammograms, that means that you do not require any of them. These are portable machines. They can go to patients' houses, they can do the mammogram, they can screen out at least 95% of the population and say, thumbs up, no need to go, come back and see us in 2 years. 5% through 4G images are going back to wherever they have the centralized station bun, and then they can be further investigated. That just changes the game altogether in terms of accessibility of healthcare. Those algorithms are only possible because we've trained them on 500,000 images to tell them machines how a suspicious nodule looks like.
And that's a wonderful point. And actually, back in 2010, I came across a very, I would say, beautiful woman who was very, very intelligent and believed in people. And she believed in the masses. And actually, she wanted to spread education across Africa. And she had come up with a physical portable device that would download content from grade 1 to grade 12. And she went to different villages and would distribute her technology to ensure that, whoever didn't have access to the internet would also have access to education. So I do believe, what I believe the UAE has to always be looking at, because we are the privileged between, the masses, is how do we actually spread healthcare access to other countries that surround us that don't have the privilege of receiving it. And this is why I love, to your question, actually I had written it down, that I wanted to talk about the 99%. Of course, we are the privileged 1% that have access to healthcare and would benefit from what we're developing. But it's the rest of the world, I would say, that needs that potential access, and why not create the innovation from here? So I loved your perspective on this. This brings me back to how can we also think about, of course, the benefits of the technology, but how can we also think about the different revenue streams today. So what can we really see as opportunities for the healthcare industry? And maybe Mr. Faisal, if you'd like to start.
في هذا المجال استاذ آية نحن كمؤسسة في الإمارات يمكن مع سياق الإخوان اللي تفضلوا في النقاط فيه عملت عملية دراسة جميع الأسعار والخدمات الموجودة عندها. تم عمل مقارنة معيارية مع جميع سواء كان القطاع الخاص أو القطاع الحكومي حتى نوصل للسعر الأفضل للخدمات الموجودة عندنا. ما اكتفينا بهذا الموضوع، أيضا في مشروع حاليا في مؤسسة الإمارات اللي هي عبارة عن دراسة تكاليف الخدمات الصحية، جميع تكاليف الخدمات الصحية الموجودة عندنا. الناس ما تفضل دكتور، لابد ان احنا نحتسب التكاليف الخدمات المباشرة الموجودة عندنا على اساس ان نوصل للتكلفة الحقيقية للخدمات الموجودة عندنا. وهذا ايضا مشروع يمتد ان شاء الله ل3 سنوات قادمة، راح نعمل عملية احتساب جميع الخدمات حتى نصل الى خلينا نقول التكلفة العادلة للخدمات الصحية الموجودة في دولة الإمارات بالتحديد في القطاع الصحي. هذا ايضا مشروع. من خلال هذه خلينا نقول مشاريع، ايضا في مشروع اخر بالتنسيق مع مجلس الوزراء ووزارة المالية اللي هي اعتماد قائمة الخدمات اللي هي الموجودة في مؤسسة الإمارات بعد ما يتم احتساب التكاليف. هذه الأمور طبعا عبارة عن اللي هي خلينا نقول الفاونديشنز. نعم، السايكل هذا كله يمشي مع عملية اللي هو إعادة الريفينيو أو خلينا نقول كيفية نمو الإيرادات الموجودة عند مؤسسة الإمارات. ما اكتفينا أيضا بهذه النقطة، في أيضا حاليا تغيير شامل بالأنظمة الموجودة داخليا. موضوع ERP مشروع استراتيجي مجرد ما يتم تنفيذه أيضا راح يساعد كثير في عملية رفع الكفاءة المالية في تحصيل الإيرادات، وطبعا هذه واحدة من الشغلات اللي تأثر في زيادة أو خلينا نقول كفاءة تحصيل الإيرادات. في طبعا مشاريع كثيرة المؤسسة تبنتها في الفترة الماضية، أو خلينا نقول نظام RCM system طبعا بالتنسيق مع القطاع الصحي. ايضا هذه راح تاثر بشكل مباشر على تنميه الايرادات. مشروع اخر ايضا موجود عندنا حاليا اللي هي مشاريع اللي هي تنميه الايرادات، ترشيد النفقات على مستوى المؤسسه. والمؤسسه الحمد لله شكلت فرق وعمل وجدان لاجل تنفيذ هذه المشاريع، سواء كان لمشاريع دعم الشباب او حتى القطاع الصحي، القطاع الخاص او القطاع الحكومي بالشراكه معهم. طبيعي خلينا نقول الالمنتس هذه كلها تشتغل مع بعض وتاثر في بعض. الحمد لله ان اليوم الاستراتيجيه والرؤيه واضحه بالنسبه للقياده في مؤسسه الامارات. انتقلنا طبعا من قطاع خدمي الى قطاع ربحي، ولابد ان نحن نفكر كيف ممكن يتم تغطيه النفقات اللي موجوده عندنا. نحن اليوم نفقاتنا رفلي 4.5 مليار، فلا بد ان احنا الجهود تكون مضاعفه في المؤسسه. ولهذا السبب كثير من المبادرات والمشاريع الموجوده في مؤسسه الامارات تمشي في نفس الاطار اللي هو في تعظيم الارباح او خلينا نقول نمو الايرادات. وهذا بشكل مختصر. طبعا احنا لو فكرنا وتكلمنا عن موضوع كيفيه استغلال تحليل البيانات اللي هو الذكاء الاصطناعي في تصميم الخدمات الموجوده عندنا وكيف ممكن تاثر تحليل البيانات. احنا عندنا اداره مختصه في هذا الموضوع، ويمكن كان لنا اتابع معاهم دائما مشروع الاستراتيجي الموجود عندهم اللي هو تحليل البيانات وكيف ممكن تصميم الخدمات بناء على تحليل البيانات. على سبيل المثال في بعض المناطق موجوده في الدوله فيها طبعا امراض معينه، فلا بد ان احنا يتم عمليه توفير الخدمات الصحيه في المنطقه الجغرافيه معينه بناء على تحليل البيانات اللي هو باستخدام تقنيه الذكاء الاصطناعي. فهذه ايضا واحده من الامتيازات، او خلينا نقول احنا الايجابيات اللي نحصلها من خلال تحليل الذكاء الاصطناعي او تحليل البيانات البيج داتا الموجوده عندنا. والحمد لله النتائج اللي موجوده او التوصيات الريكومنديشنز الموجود في مخرجات المشروع جدا مميزه، يمكن انا اطلعت عن قرب عليها، وممكن ايضا هذه تساهم في عمليه تخطيط الخدمات الموجوده على مستوى المنشآت الصحيه التابعه للمؤسسه. بطبيعه الحال راح يكون في هناك تعديلات وتغييرات كثيره على الخدمات اللي نقدمها. كثير من المناطق الجغرافيه الموجوده في دوله الامارات ما كانت توصلها الخدمات هذه من خلال تحليل البيانات اللي هي راح تكون من خلال نظام او مشروع في اداره الاحصاء. راح يساهم في إعادة تخطيط هذه الخدمات الموجودة عندنا بمستوى الدولة. أيضا نقطة أخرى بالنسبة لي كان أنا مقتنع تماما يمكن الفترة البسيطة اللي أنا كنت فيها في المؤسسة سنتين، الاتجاه العام أيضا جدا إيجابي لتوفير أو البحث عن الخدمات النوعية في المؤسسة. ما اكتفوا بموضوع التحليل، لابد أن احنا حاليا نفكر بطريقة أن كيف ممكن احنا نحصل على الخدمات النوعية الصحية اللي هو البيشنت المجدد. وهذا أيضا واحدة من الاتجاهات الإيجابية واللي تأثر بشكل مباشر على الإيرادات المؤسسة. فهذا بشكل سريع اختياري والحضور.
Okay, great. Thank you, Mr. Faisal. So I will try again to translate. I really hope everybody is understanding him. Okay, so if I make any mistakes for those who understood in Arabic, you won't know. So, when we talk about Emirates Health Services, something that's very impressive, and I'm sure we can take this across to different industries. We talk about healthcare being innovative because it doesn't think as a government entity, just as a government entity. Apologies, correction on that. But we think more like the private sector, and private sector is built for revenue optimization, right? So how can we actually generate more revenue? How can we provide more value to the communities that we serve? And the perspective of Emirates Health Services is how can we become much more patient-centric? How can we work with our partners in the industry to try and think of monetizing on big data, right? So how can we actually look at patient care in a much more specific way? And finally, personalized medicine, of course, is going to be an aspect of this. So how can we actually integrate that in? And something that's very important that Mr. Faisal mentioned a few times was, in the next 3 years, they have a very specific strategy. And this is why he was actually mentioning both of you, to think about how to really assess the main costs of the business and how to look at the opportunities, with partners like Cerner to also, look at what else they can do for their patients to serve them better. So all in all, that's how I would summarize the response. I'll push back the question to you for another 1 or 2 questions. I'm not sure how I am doing on time. If my team would give me I'm okay? I have 10 minutes. Okay, perfect. Thank you. I will. The third question I had actually for Cerner was, how can organizations employ health information technology to expedite their agenda of clinical excellence and patient safety?
Right. So every investment we do and every intervention we do, we talked about this triage of one of the big elements of that triage is healthcare quality, and the convention logic states that to increase the quality, you probably have to increase the number of people surveyed. You probably increase the number of facilities surveyed. You probably have to hire more people. That's a conventional logic says that more. If you want to cut down the waiting time, you serve them more frequently. You need more facilities. You need more doctors. You need more nurses. Actually, on the other side, from the health economic perspective, it's been proven to be completely false. What health economics principles state that if you want to reduce the variation of care, if you want to make sure that everyone has a protocolized care to a certain extent, you make the entire care process very, very predictable. You make less mistakes. You do no harm to your patient when they come into your facility, so there is no unintended harm to their patient. You make sure that they receive the optimum care required. You can actually bring down the cost while the quality goes up.
Sorry, I'm going to interrupt you. I would love a use case on this. So can you give us an example of something that perhaps a before and after, so we can give a visual to the audience on this?
Perfect. So a very specific example I'm going to use, there is a particular medication which is given to patients who have high cholesterol. This medication is let's say 1 dirhams. That medication is tolerated by 80% of the patients without any harmful effect. However, 20% of them can have an untoward effect which can be managed. Now, one way of doing could be higher cost, you give them a medication which is 10 times the price to everyone, which means that your cost is going to go immediately up. The other way, the more innovative would be doing it, is to test everyone who requires this medication first couple of months on the lower cost medication, observe them through a system automatically to make sure nobody falls through the system, and only 20% of them who do require an alternative are given the alternative. This is actual use case in terms of my clinical colleague simvastatin and atorvastatin medication that we have done in UK, and in 6 months we saved them 1.3 million pounds in worth of revenue just on a single medication switching, and was done from the perspective is going to be the safe thing to do. Patients are monitored, every single one has to go through a protocol, and it's going to approve proposal that we went through. So that's a very, very simplified way of explaining what I was trying to explain. But in terms of having your patient safety, so every organization like EHS has a patient safety committee. Every organization like EHS has a clinical content and care pathway. They have clinical protocols. What is required is that these committees, these clinical protocols, do not work in silo or exist in silo. When you are going to procure a particular technology, those aspects are forefront of your thought process. Those aspects are considered, those questions are asked. Most of the time you'll find that the vendor who's actually proposing this has got some generic use cases already covered, but that only covers 40% of the actual potential that you can come out of it. You definitely need your teams to make those technology work harder for your organization. And that's where your people and your patient safety considerations come in. We have a saying called prevent errors of omission and prevent errors of commission. With every technology, these are the two dimensions. Means errors of commission, system technology should be in a way that it should hold somebody's hand to say, sorry, looks like you're going to make a mistake. Are you sure you're going to do that? Are you sure you're going to give a penicillin to a patient who is penicillin allergic, for example? And the errors of commission means that, are you sure that this patient does not require a recommended treatment? This treatment is recommended for the condition they are suffering. You looks like you have not prescribed it. Either your treatment looks incomplete. System or technology should put their hands up and say, looks like your patient should have received this, but please record your reason for not giving him appropriate treatment. We covered both sides. We touch 90% of those elements.
The human error and the technology suggestion. Beautiful. Mr. Ghalib, do you have anything to comment on this question?
Yeah, no. Look, I think fundamentally two things, right? One is obviously this wealth of information that we're generating enables us to improve the protocols, right? Which I think is what the Dr. Yasir is alluding to. But information being sort of the basis, the foundation for it. So, yeah.
دكتور تكلم بشكل مستفيض على موضوع الاخطاء الطبيه وكيف ممكن ياثر على موضوع الايرادات وحتى الافشنسي والشباب. اتوقع انه كافل يعني نقاط كانت في نفس السياق، اتوقع هو غطى يعني.
Very thorough answer. Perfect. I would love to just touch upon startups, because that's a big part of what we do at Bolt as well, is we train startups. And an example of one of our healthcare startups is called P4ML, and they're focused on precision medicine related to rare diseases. So I would love to know from you, from the three of you actually, what would be some startups that you've noticed or would find notable in the industry that could be tackling some big things, either locally or globally? Do you have any name examples for us, and perhaps what they do?
I think one of the impressive startups that I came across was predictably around telehealth, done differently. What that particular startup tried to do is not to just create a video conferencing platform and you can talk to your patients, which is almost every telehealth startup is doing. But they became an enabler like Airbnb. They became an enabler. They created that sort of very comprehensive tools and launch it and white label it in a way that if I'm an organization, I'm an EHS-like organization, I'm a hospital, I can completely buy into your ecosystem and create the entire, tomorrow I can go live with the entire virtual hospital. And if I'm a single doctor surgery sitting somewhere, I can equally enjoy all the benefits just by paying a particular subscription. And just because they had a multi-tenanted cloud-based solution, that meant that they can keep on adding value-added services based on what they were learning. The turnaround from what they were learning and what they were putting back and what they were learning and putting back from the extensive ecosystem they were serving was just amazing. At the end, literally everyone, this was for everyone's benefit. We had providers benefiting because they were able to provide those patients who are at home. We had pharmacies benefiting because they were initially getting a prescription and they can generate more revenue out of it. And on top of it, we had extensive amount of very clean data coming out for the entire population, for example, Dubai, to say who is suffering from what and what medication and what their preferences are and which pharmacy are they want their medication from and which pharmacy got dispensed. So very healthy, clean data for us to exploit AI and machine learning.
And I'll follow this up with a quick question on, how do they make money? So I think this is the first question that we always ask our startups is, what's your business model? So what would that be for Predictably? I'm assuming they're UAE based.
They are international now, but because of the way they assemble themselves, so initial of course was white labeling their solution and offering it to hospitals and organizations. That was first revenue. Second revenue came from when they added the pharmacy aspect to it. So now for every pharmacy that fulfills a particular prescription has got a certain percentage that because they are using their platform. Third being individual physicians who have a particular subscription on a monthly basis, so that's the other one. But by and large, which was the most recent one, because now they look into a year worth of very rich data and they were able to monetize that data with the help of third parties. So that was I think an unintended initially. They didn't realize that will be the case, but that data held more value than anything else, frankly.
Thank you, Dr. Yasir. That's wonderful as an example. We'll look them up after the panel, actually. Mr. Ghalib, would you like to share any examples?
Yeah. So I think as Dr. Yasir mentioned, right, there are a whole host of startups in health technology or in medical technology, and you can think of them or structure them along a patient journey. So, and each part of the patient journey, there's a particular problem that needs to be solved that these different startups are trying to solve. So you can start with doctor discovery. So there's a lot of platforms that place doctors online and help users and communities interact and understand sort of all the options that are available to them. So it solves the problem of information basically, and choosing your physician is a very personal choice. And I think we'll all relate to this, that whenever we have a problem, we ask for, I get asked a lot, for this problem, which doctor should I go and see? All the way to, symptom checking. WebMD's been around for 20, 25 years, but now you're starting to see very, very advanced versions of that where, the protocolized care with complete automation end-to-end. You can almost have primary care platforms and beyond. You're seeing some of these globally, especially in the UK and the US, emerging. And you might have network effects almost. So these are going to become so powerful and so strong on the foundation of data that we've built that they may actually sort of almost take over the world in a way. So you've got a whole host of startups around, so you have a problem, you need to discover the doctor, then check your basic symptoms. There's a lot of startups in the whole booking type of space. Sometimes they're integrated. Then I think teleconsultation, Dr. Yasir mentioned, I think that's the most active and biggest space. But even then, following on through the patient journey, right? So you have your ERX, your e-pharmacy, e-prescription. There's a whole host of very interesting startups that deal with chronic patients that are actually then, dealing with medication adherence and a number of then, very, very specific disease areas. And supporting patients with, behavioral improvement, et cetera, that actually fundamentally makes most of the difference when it comes to health and well-being outcomes, right? So I think there will literally be hundreds, thousands, tens of thousands of them, and you can classify them along the patient journey, and some integrated, some focusing on a very, very narrow use case and problem that they're trying to solve, but very, very rich space. And again, when it comes to startups in general, I think healthcare is one of the lagging industries. So we're going to see in the next 10, 20 years, sort of a lot of activity happening here and a lot of innovation.
Mr. Faisal, if there's إذا في شركات ناشئة يلي أنت اشتغلت معهم أو تعرف عنهم، فينا نخبر الجماعة يلي معنا اليوم عنهم.
موضوع الشركات الناشئة أكيد كمؤسسة دائما داعمة، سواء كان للشركات الناشئة سواء كانت الوطنية أو حتى القطاع الخاص في دولة الإمارات. موضوع الرقمنة أو التحول الإلكتروني وكيف ممكن يتأثر في الافشنسي وموضوع الريفينيو، طبعا هذه كلها عناصر كلها يعني دائما تؤثر سواء كان في المؤسسة أو حتى تؤثر في العملاء أو خلينا نقول المرضى الموجودين. المؤسسة يعني تتبنى اوريدي هذه المشاريع او التوجهات العامه الموجوده على مستوى يمكن بدايه حديثنا تكلمنا نحن كمؤسسه انطلاقا من الاستراتيجيه العامه لدوله الامارات دائما نتحرك في نفس الاتجاه. التعامل مع او تطوير خلينا نقول التكنولوجيا بما يؤثر على العملاء او يخدم العميل او تقديم الخدمه ورفع الافشنسي فيها وتقليل الاخطاء الطبيه. طبيعي هذه الاشياء كلها المؤسسه تعمل عليها بشكل مستمر. موضوع التحسين المستمر ايضا موجود عندنا خطه للتحول الرقمي موجود على مستوى المؤسسه بالتنسيق مع مثل ما قلنا نحن الشركات اللي هي موجوده سواء كانت الشركات الناشئه اللي هي قادره على تبني او خلينا نقول تنفيذ هذه المشاريع او حتى القطاع الخاص. يمكن احنا عندنا شركاء استراتيجيين ومنهم سيرنر واحده من الشركات ما نقول احنا ناشئه لكن هي من الشركات الكبيره اللي احنا نتعامل دائما معها في كثير من خدماتنا. الشركات الناشئه نعم لها فرصه والاتجاه العام في القطاع الصحي على مستوى العالم هو القطاع الصحي. يمكن موضوع الكوفيد اللي حصل يمكن فتح مجال امام الشركات سواء كانت الناشئه او حتى الشركات اللي هي موجوده حاليا انها تعمل عمليه استثمار في هذه القطاعات. المؤسسه دائما يعني تعطي المجال امام الشركات هذه لتنفيذ استراتيجياتها او حتى تنفيذ خدمات الموجوده عندها سواء كانت التطوير او حتى موضوع التحسين المستمر. فتفضلوا فيه الاخوان يمكن بشكل متعمق اكثر من الجانب الفني. احنا الان نتكلم من الجانب المالي ايضا. نعم كثير من الاتفاقيات اللي حصلت لها تاثيرات ايجابيه من ناحيه ترشيد الانفاق، عمليه نمو في الايرادات، وفي مبادرات كثيره حصلت على مستوى المؤسسه في هذا السياق والحمد لله كانت لها نتائج ايجابيه.
Okay, Mr. Faisal. So maybe to just summarize, I mean, when it comes to startups, I mean, at the end of the day, it's just about finding innovation. And how we define innovation is about having a lower level of thinking, taking it to a higher level of thinking, right? So it's not really going to always be about creating something so groundbreaking. Actually, the other day I was discussing this with a few partners about why are we not adopting certain technologies? And the simple answer from some of the big companies was because it sounds a bit complicated. If we are going to advance into a new idea, we cannot go from zero to hero. We have to have steps that we take as companies as well to be able to, adopt these different technologies. So I think, healthcare might be a bit behind, but I think there was no shortage of support around COVID-19. I mean, I was watching a panel that was done for the AI conference right when COVID was happening, and I think most people are excited to come back. And the Dubai Health Authority was represented on the stage, and the representative said, you know, we were prepared. We were 100% prepared for COVID-19, and we put all the right restrictions in place. And we had all the right beds ready for any of the patients that came in. So I think if there's one country in the world that is ready to take on what's coming next in healthcare, it's definitely the UAE. So I guess I'll conclude that for the panel to say thank you very much to our wonderful panelists, Dr. Yasir Khan, Mr. Ghalib Hafiz, and Mr. Faisal. Younes, thank you so much for your time with us today. I'd love to give the microphone to the audience to ask any questions to our wonderful panelists. Yeah? I'm just gonna actually I'll give my microphone to you actually. No.
Hi. Thank you for your talk. I have one question about if AI will also applicable for the mental, for physical. Okay, we understand. You can measure all the statics, but for mental, I don't know. AI can also apply for this. You understand my question? Yes, that's my question.
Maybe if I could summarize, you know, of course we're talking about patient support, but also on the mental health side, how can AI support the healthcare industry?
I think the mind and the body are connected, right? I do think there is a lot of applicability of AI, and in terms of what you measure in your body that is reflective of what is happening in your mind, right? And again, I'm not a psychiatrist or a psychologist, but you know that's my fundamental understanding is a lot of the markers that you would find in what you can see and measure physically will also then apply in those realms.
If I may add, so mental health as I think I can understand the spirit of the question. You're alluding that mental health is it does not depend on the physical parameters of fever and heart rate and respiratory rate and so on and so forth, and it's because of that non-objectivity it becomes difficult to stratify or measure. Good thing is that AI is specifically good for these use cases. Because for everything else, you can determine to say if the heart rate is more than 85, it's abnormal, and you can have a cutoff. For mental health, it's not the case. This is where the real pattern recognition comes in. I remember 18 years ago, that's my student life days. My research projects at that point was virtual reality for hemispecial neglect, one of the psychological disorders. And then at that point, I was amazed by the sophistication of the algorithm that were going in that will allow someone to wear a big helmet and interact with some, at that point, very cartoonish characters, and now virtual reality have improved a lot. But your interaction with them and what do you do with them and how you interact with these avatars can give you, after an hour of the interaction, give you that kind of risk stratification to say where do you fall under the risk of depression or risk of suicide or risk of however you want to stratify. So you're absolutely right that because of lack of objectivity, we do require additional support, being very objective about it. Good thing is that because of now we have extensive data points that we can capture, how you get up, how your body language is, how your demeanor is. Even the cameras can measure someone coming to the door and can be very accurate in telling them what kind of mental state you are in. So AI and machine learning is a misnomer from my perspective. Is nothing apart from advanced pattern recognition. It gives you throw it 1,500 parameters and it finds that particular pattern that is applicable to you. And mental health is primed for that.
interesting and informative discussion and panel. I have a comment rather than a question. I think this is a revolution, and it's going to, come whether we like it or we don't, whether we agree or disagree with it. And I think the best thing that we can do as a healthcare providers or workers or people who are working in this industry is just to see where is the best place and where are the areas that we can best utilize. And I think there was one point here in your title of the panel that is very important, which is the value. Because when I think of it as a physician, I agree with you. We were all resistant to changes and using technology because we thought that this is taking a very important factor from us as physicians, which is the value, which we describe it in different way. Some of us say human touch, some of us say, the feeling, some of us say providing care with passion, etc., etc. All of it's now concluded into or included in one word, which is the value. So I think the focus should be in the future from now or in the next 5 to 10 years is that where we can invest where values are not touched much, or if it's going to touch it, it's going to do it in the best way possible. The way I think of it as a physician now, when I think about robot and all of the new technologies that are coming in place, is that, okay, do I want to be provided with a meal by my mother or by the robot? Because when my mother provides me with a meal, or my mother or my wife provides a meal to my child, it has a little bit of value in it, which is the bonding, the social skill, the etc., while the simple act itself can be done by a robot. Whether you are cooking it yourself or the robot is cooking it for you, the act itself can be done. It's just the passion, the value that comes with it. So when we are thinking about providing care to our patients, it's the same thing. Yes, there are many studies showed that the way you interact as a human being actually interferes with the care and the response that you get from your patient, right? So if certain physician treat you in a certain way, actually, despite providing the best medication or test that's available, the patient can still go down if the care is not provided with the value that you're talking about. And the same goes with the quality, the medical errors and stuff. So I think technology can provide a lot of solutions to some areas that not directly touch with the value, like medical errors. If you automate the pharmacy and you start to make your calculation of medication automated, you might reduce a lot of errors, and as such you provide better care. And at the same time you can address the cost and the revenue you're talking about. So I think this is where the concern is, and this is where most of the companies who are going to start invest in this, or the more they go into deeper, they should address it so that they can address both sides, the physician and the patient. Because as a patient also, we have the same concern. If I'm a patient, I don't want to go to, or still I have this kind of a fear or phobia that I go into a kind of an e-clinic that we call it now, or a telehealth that you call it now, and I don't know, am I really going to get the care that I want or I deserve or I need or not, right? Still people are in that, not there in that comfort of being that, okay, it's different when I see the physician in front of me because I can look at their gesture, body language, I see how they talk to me, how they ease up the solution for me and so on. But I think it is a very, very interesting topic, and I'm happy I came to it. And I think we as healthcare providers should put it in our agenda and everywhere we go, because it's a revolution, it's going to happen, and we should use it in the best way we can. And I thank you again for, they got put the light on this topic. Thank you.
Assalamu alaikum. I'm Dr. Ahoud, head of Prague PHC Network. I would like to thank you for the very interesting and nice panel. Actually, I have two concerns. One of them that we don't have a closed feedback loop from the patient side. Usually, the feedback happens either the patient would come back to the clinic or the doctor will reach the patient if he has a scheduled plan, if the result came and such. So since we are using the improved system, would it be better to create a way that the patient could contact us back? Like, for example, we are facing the acute drug reaction monitoring system. So sometimes it's difficult to wait for the patient to come and speak with the doctor. But if we put an easier way for them to reach us, maybe it will be for certain population who would like to do it, but if we create it, this will be an additional point. The other factor is that regarding putting the restrictions in the system, saying that alert regarding certain part, this can be applicable, but we have a different variant backgrounds of our patient. We were just going through the expo, and we said that 80% of UAE population are non-locals. Also, we have different backgrounds, different age groups. We cannot deal with the pediatric group, same as the elder. So I think the system also should have more than one option to deal with each patient. The doctor can choose which one will be suitable for that patient to be more stratified after we study the population we are dealing with, not dealing with each patient the same way we do for the other. This may be more valuable for the one who are working on the field. They will be able to choose which way to do it. But from your side, to have the choices will be great for us as well. Thank you very much.
If I may touch the 2 points that Lady mentioned, I think the one was around the variation of the population you serve and the kind of alerts. So it touches upon my point of that medicine is influential science. What is good, what is acceptable for person profile A may be very different from person profile B. Before even I go to a local or expat discussion or number of nationality they will serve, I'll go to even basics. Basics is that when you just pick up blood pressure, the blood pressure or even a heart rate, it changes from when you are 6-month-old to 1-year-old to 3-year-old to 5-year-old and stabilizes at the age of 7 or 8 when you actually get to have 72 beats per minute. A child is having 145 beats per minute. Unless we have a smarter system, unless we have those kind of provision which look at the nationality, look at the ethnicity, look at the age, and then compares that profile, it will start alerting for which will be an over alerting and won't be good. So I get your point in 100%. This is where the clinical logic needs to meet the technology so it can serve you right. If it's wrong 80% of the time, then the 20% time it is correct, you're gonna ignore it anyway. So hardly any issue.
Hi everybody, thanks for our lecture about this discussion and panel. I'm Dr. Fafa from At1 Primary Healthcare Department. I think after comment of my colleague Dr. Wissam and Dr. Hood, we came to the point which was stated by by Dr. Yasir, Ghalib and Faisal, that you say we will implement AI, but as medical facility, our customer is different. Like you said, there is evidence-based medicine, but there is no evidence-based medicine like engineering, contracting, especially in family medicine or in hospital or any medical facility, there is evidence-based medicine. So we will come to the point that the patient is the customer. So patient experience will enter with the AI implementation. That's why in our experience as a physician, and I think all of them agree with me, that when we will tailor the AI, we will tailor it to some services, other maybe it will not applicable, but it will be minority where there will be not applicable, and we should see the risk as Younes said that, Mr. Younes, we should do assessment and risk, and there is AHS assessment team. They will tailor these according to the service provided by our team or by our clinic. So I think this point is so crucial. In the spirit of the protocol, it will be there, like as His Highness Sheikh Mohammed bin Rashid usually they say, it's not just the protocol, the spirit of the protocol for minority of the service. That's what they think about it, I think, and what they worry about it. But if there is assessment team, I think this will be not a problem. And as I said, it's minority, not majority, that the AI will not tailor to these services. So thanks again, and why I comment, because I think you said that in the beginning of the lecture, that there will be team, there is assessment, then we will tailor the service to according to what service we have. So thank you, and I hope this will reach our people who's in the acting in the service, not just like the manager. Because really, this is, as Dr. Hassan said, this is a revolution, and we were proud that AHS will come to this point, and we always be proud about UAE and where it point that it reached. So thank you, thank you.
Just to establish one point, very good point made. From AI perspective, finding the right use case for AI is 50% of the job.
Yeah, I totally agree with you. That's why it was
100%. A lot of discussion, a lot of consideration. I love the example that Dr. Isam mentioned, that if meat is cooked by my mother, it looks different or feels different than by a robot. So let's not use AI like a hammer and everything looks like a nail and we just keep hammering. The 50% work is finding the right use case, that unmet need that cannot be met from traditional established methods. We do have protocols which are 92% efficacious and safe and then working. We don't need to, if it ain't broke, don't fix it. So they're working. But if they have a need which is 8% where it's not working, to your point, yes, that's where it comes in.
Great, thank you so much for your question. And I love that you all enjoyed the panel. That was the most important thing for us, is that you received the value from this amazing panel. So a big round of applause to them. Thank you so much, gentlemen.
Thank you.
It was extremely insightful for us, and actually we will be even writing an article about today's session for you to be able to even read about it later. We have the Zoom recording for you all. And thank you so much. I hope you all learned a lot. I did, as well as a moderator, which is the pleasure that I get being with incredible, intelligent, and very, very welcoming panelists as well. So thank you so much, gentlemen. We just have a small, yes, please. And this is Lama.
Thank you very much. This is an amazing session. It was very informative, and thank you for the speakers. I'd like to invite Dr. Isam Hwayan, who's our head director of hospital, to address the speakers.
Okay. On behalf of EHS and His Excellency Dr. Yusuf, I would like to thank our panelists for being here today and giving us the valuable time, and for this very healthy and fruitful discussion, and very informative. And thank you all for attending the session and interacting with the panelists. So we would like to just give you small gifts from our side, and something that you can remember the session with. If you allow me.